So good morning, everybody. My name's Lisa Scully and I'm Professor of Social Policy at the University of Salford. I'm also co-lead of the Welfare at a Social Distance project. I'm really pleased to be here today to introduce this fantastic seminar where we'll be looking at attitudes towards inequality, the welfare state and social security benefits during COVID-19. This is a collaborative event with CASE, the Policy Institute and the Welfare at a Social Distance project. But I wanted to start by saying thank you to CASE for hosting this seminar, and also a big thank you to Nora at CASE for helping to organise the event. We've got a fantastic lineup within the next hour. We will have 3 great presentations from 4 speakers. I'll just very quickly go through the format and then I'll hand over to the speakers. We're going to start with a presentation from Bobby Duffy, who is Professor of Public Policy and Director of the Policy Institute at King's College London. We then have a presentation from Rob De Vries and Kate Summers. Rob is Senior Lecturer in Quantitative Sociology at the University of Kent. Kate Summers is a Fellow in Qualitative Methodology at the LSE. Kate and Rob will be drawing upon data from the Welfare at a Social Distance project. And then we'll end with a presentation from Tanya Burkhart, who is Associate Professor in Social Policy and Associate Director of CASE at LSE. The format is that the presentations will all be done back to back, and then we'll allow plenty of time at the end for Q&A. So if people want to put questions in the chat, or if they want to wait and then raise their hands at the end, we'll make sure that we allow plenty of time for people to ask questions and discuss the findings that are presented today. So without further ado, I'm going to hand over to Bobby, our first speaker. Thank you.
Great. Thank you so much, Lisa. Great to be here and really looking forward to this, the other people's presentations and the discussion. Let me just get my slides up, which hopefully you can see full screen now. So yes, I'm going to talk about a study that we did as part of the IFS Deaton review of inequalities on attitudes to inequality. We just published the chapter on attitudes to inequalities, which drew on a big review of existing data and some of the literature, but then did a new survey during COVID about this time last year. So I'll be drawing on that a bit too. And thank you to the authors of this at King's on the front cover here. So I'm going to try and make 7 points in my 10 or 15 minutes, just really quickly run through. The first one is that looking at the trends in existing data, there's a large and stable majority that income gaps are too high. So the BSA trend on in Britain today, the gap between those on high incomes and those on low incomes is too large. Looks like this over time, back to 1983, which is pretty much pretty stable at around 8 and 10 people thinking that the gaps between high and low are too large. But when you look at the BSA trend on government should redistribute income from better off to those who are less well off, a lot fewer people saying that that should be the response. So again, bobbles up and down a bit, but around 4 and 10 over that period saying that we should be redistributing. There is a different trend on European Social Survey, whether the government should take measures to reduce differences in income levels. And that is quite a bit higher in terms of people's support for it, but it's still lower than the proportion of people who think income gaps are too high, but it's around 6 and 10 over time, people are agreeing with that. And we did quite a bit of unpicking of what's the difference between those in the study. And it's very much that the redistribution term seems to turn conservative voters off, or people with particular worldviews off. And that broader conception of government should take measures and not defined is more acceptable to a wider group of people. And we covered that a bit at Conservative Party conference yesterday, day before, and really interesting discussions from a conservative perspective on why that is and how people see the world. So I think, I mean, the second point I wanted to make is that worldview point is really important in explaining these gaps. We think some of this gap is related to whether you see inequalities as structural or down to the individual. So we did some latent class analysis, looking across all the different, lots of different measures within our new survey, and we came up with these three groups. Structuralists, who are about a third of the population, fairly evenly split groups, who see characteristics outside of the individual's control as important in determining their life chances and inequalities and outcome. And it does, interesting, it does cut across demographic groups. It's not particularly concentrated. It is more labour and it is more graduates in this group, but it's not entirely, it doesn't overlay it entirely. I will show you some splits by Labour and Conservative and Leave Remain as well, because I think they do, they're very related, but they explain different sorts of things in some ways. And then at the other end of the spectrum, we've got individualists, again, about 3 in 10 of the population, and they don't consider factors outside beyond the individual's control to be important. They reject quite a lot of them quite strongly. And again, it cuts across more conservative, as you'd expect, and fewer graduates. And then you've got this in the middle group, as we call them, and they're in the middle in two senses, in the sense that they're somewhere between those two groups in terms of their attitudes, but they also don't have strong views on lots of this. They are more disengaged, but their profile is closer to the individualists in terms of their characteristics. I'll just give you one example very quickly of the sorts of differences that you see just picking up on discrimination measures. So we told people on average, Black people in Britain have lower earnings, more likely to be unemployed than white people. Do you think these differences are due to a range of different factors? But drawing on a US question that's asked a lot, less often asked here. And first group is because of discrimination, where about half of people say that's the case. 3 in 10, though, say it's not because of discrimination. And then one of the other categories was because Black people don't have the motivation or willpower to pull themselves out of poverty. And that's much more strongly rejected by most people, but there's still 13%, still 1 in 7 Brits who say that that is the case, which is a bit of a high level, it seemed to us. But when you compare it with the US figures, we are much lower on that kind of belief, 36% in the US, and that's at the end of a trail where that figure has been going down. So nearly three times more likely to think that in the US. But the main point of showing this was just to show how that view of discrimination, a structural kind of explanation for worse outcomes, varies hugely between the different groups. So you've got structuralists, 2/3 of them think that is important in explaining differences between Black and white people's employment outcomes, down to 33% of individualists, and so about half the level of individualists. One point to note on this is that even within the structuralist group who do think that structural explanations are important, there's still 1 in 5 of those who don't think it is because of discrimination. And that leads on to the third point, is that there is a general belief in the importance of individual effort and meritocracy in the UK. A lot of international comparisons show become quite high on that kind of belief in the importance of individual effort. And you can see that on this question where we said, what are the most important things, well, sorry, how important different things were for getting ahead in life. And you see the top two across Conservative and Labour, or near the top for both Conservative and Labour, are hard work and having ambition. So they're seen as important to both those political groups. I shouldn't miss education coming underneath that, very important to both groups too. But the interesting thing in terms of the structuralist versus individualist kind of worldview is that it's on the factors below that, knowing the right people, coming from a wealthy family, having well-educated parents, political connections, race and gender, that Labour supporters are just higher than Conservatives. So it's not that the Labour supporters don't see individual effort, hard work or ambition as important. It's just that they overlay these other structural factors to a greater degree than Conservative supporters. And that belief in merit was seen during in some of the measures during the pandemic. We asked the people during the pandemic, how important do you think different set of factors were in determining whether people lost their jobs during the pandemic. First of all, luck, and people generally don't like to assign things to luck as a general sort of rule. So very few people picking out luck is very important, and not many more saying it's been fairly important. In contrast to performance at work, which more people saying performance at work was important, whether you lost your job during the pandemic, than luck, which seems like quite a harsh view of job losses during an indiscriminate global pandemic in some ways. But it's a sort of reflection of that belief in it's down to us as individuals. And that includes 40% of structuralists who believe it was to do with performance at work. This doesn't cut across. It's quite a embedded feeling. So fifth point I want to make was there is some sign within this. We did ask questions about what's the pandemic going to do? What is the pandemic doing to inequality? And there is some signs that people do think inequality will increase. You've got 44% people saying it will increase, but huge range, this time splitting by an interlocking Labour and Brexit identity, huge range across the population on this, from 3/4 of Labour Remain supporters down to 28% of Labour Leave, and the big break is that Labour Remain versus the rest, and the others are much closer together. So again, this sense of very different perspectives depending on your underlying political views and broader values is very strong. And I think we did a more detailed analysis of looking at how individuals answered different sorts of questions, but one of the main themes, I guess, from that was that it's very, even with the pandemic and all the huge effects from the pandemic, it's very incremental changes, it seems, in people's and second, that it builds on underlying attitudes, existing underlying attitudes. And you get some sense of that from this comparison. We asked people, how equal or unequal do you think Britain was before the coronavirus outbreak? And again, strong belief that we're unequal, unlike the income gaps being too high. But when you ask the people how unequal do you think we will be after recovered from the coronavirus outbreak, the combined very somewhat figure is actually not that much different from before, and not people's perception of before and after. But what you see is an increase in the very unequal. So it's a kind of notching up of people who are already thinking that Britain is unequal, rather than a changing of minds of people who didn't see that before. So it's not unlike the pandemic. Generally, it's sort of accentuating and accelerating existing views or trends more broadly. Sixth point wanted to make that is in terms of the actions that have been taken during the pandemic, there is obviously very high support for furlough scheme. People, nearly each of the groups thinking the government's furlough scheme is essential to protect people's livelihoods. Very few saying the government shouldn't be doing things like that. The economy should just be left to adjust itself in these extraordinary circumstances, and that kind of cuts across groups. So there is the sort of extraordinary things that the pandemic has required us to do have been supported by people. But again, the variety of views is still startling in many ways. What we did is we compared some of the classic questions that have been asked on BSA and lots of other questions about whether unemployment benefits encourages reliance on the state. And we asked the same questions for the furlough, and then just compare that across. So if you build that up, starting with Conservative voters' views of unemployment benefits in light blue, so you've got 2/3 of Conservatives thinking that unemployment benefits encourage reliance on the state. That then halves when you look at Conservative views of the furlough scheme. 35% of Conservative supporters think that the furlough scheme encourages reliance on the state. Still quite high, 35, a third of people thinking that is the case. And it's actually slightly higher than Labour's views of unemployment, Labour supporters' views of unemployment benefits, the more regular unemployment benefits, at 30%. And then Labour's views of furlough, only 13% of Labour supporters think that the furlough scheme is encouraging reliance on the state. So again, you see very distinctive views across different groups. But the final point I wanted to make is that the pandemic does seem to have opened up at least some space for discussing the government's role in tackling inequalities. And we asked both types of questions about redistribution and then taking measures to reduce income levels. And what was clear about that was it was the Conservative supporters who shifted their views depending on whether you talked about redistribution or whether you talked about taking measures to reduce differences in income levels. And on this broader, less defined question from European Social Survey of taking measures to reduce differences in income levels, you actually get quite a high level of support that it has, the pandemic has shown that there has been a need, 55% of people agreeing with that overall, including 4 in 10 conservatives. So again, a bit more of a sense of that. Although interestingly, that segmentation that we did, the LCA, it's only 2 in 10 individualists that think that this crisis has shown that we need to do that. So that segmentation based on people's attitudes to inequalities shows that there is quite a deep sense that we shouldn't be interfering among that segment, that third of the population. Final point is that while the key theme of attitudes to inequalities is that we've got very different perspectives depending on our worldview, and there's very little, it divides us quite a lot. There is at least one unifying theme, and there is UK's high level of concern about area-based inequality does seem to run across groups. So we asked people which 3 of the 4 of the following types of inequalities do you think are most serious for Britain? And it's actually area-based inequalities between more and less deprived areas that came top overall of the list, more or less equal with income and wealth. But crucially, I think very similar across different groups between Conservative and Labour supporters, pretty even compared to, say, concern about income and wealth inequalities, and particularly about racial inequalities. And the same thing across our structuralists and individualists. People that focus on area-based inequalities between more and less deprived areas was something that stood out as unifying across different groups. And it was something that stood out. We did an international survey across 30 countries as part of this, and the UK came top by some distance compared to European and North American countries on that area-based focus for inequalities. So very quick reflections. I think what the overall study shows is that whether you worry about inequalities depends on how fair or unfair you see them to be. That's obviously one of the key themes from Angus Deaton and his review generally. Is that understanding what's seen as fair or unfair is incredibly important, which in turn depends on your view of the causes. I would suggest from this work, which is crucially that distinction between individual causes and structural causes, which in turn are related to deeply held values and worldviews, so that they are relatively unshifting over time. And you can see that consistency across very different inequality conditions over long periods suggests that there is an important values basis to this, which underlies a lot of that. That's not to say that things haven't moved, and I think we certainly looked in the report at movement in other attitudes, belief and benefits being too low and cause hardship have definitely been moving around and rising in a long way, and I think other colleagues will be presenting on those types of things. Those types of things do shift. It's just these other more values-driven ones shift less. And there is some common ground around area-based inequalities. We did, IFS did additional focus groups on this with Ipsos Mori about what people understand by that area-based inequalities. And we need to be really careful in interpreting how that relates, particularly to the levelling up agenda right now, because it was very much a local, very local, not a simplistic north-south divide or regional level inequalities that people were thinking about. It was much more often to do with very local circumstances and their people's individual experience of areas right close next to them that were clearly had lower life chances than other areas nearby. So we need to be really careful on how we interpret that, not to come to the wrong conclusions. But final point is, I think it is open door for discussion. Pandemic has done that, and the experience that we're going to be going through post-pandemic has done that. But I suppose the main point of the research is that only works if we understand the very wide variety of starting points that people are coming to this with, and hopefully this research helps explain some of that. Thank you.
Thank you, Bobby. That was fascinating, and perhaps a little bit of hope at the end that we've opened up spaces for discussion about inequalities. We're going to go straight into the next presentation now. So we're kind of moving away from broader attitudes to inequality to look specifically at attitudes to the benefit system. So I'm going to hand over to Kate and Rob, who are going to present from our welfare at social distance project.
Just remember to unmute myself. Hi, yes, so yeah, we're going to drill down and look a little bit more specifically at attitudes towards the welfare system. So I'm going to talk through some of the quantitative findings from our research on this, and then I'm going to hand over to Kate to talk about some of the qualitative findings. So to set this in a bit of context, there are broadly three really good reasons to expect that the pandemic would have shifted people's attitudes in quite a profound way towards the welfare system and towards benefit claimants. The first one basically being that there were many more people claiming. So you've got a much bigger, much more diverse group of people having an experience of the benefit system. And also alongside that direct experience, you've got their friends and family as well experiencing now knowing someone who has claimed benefits or has had to participate in the benefit system. And in addition to that, in addition to the unemployment and low pay benefits, we've also got people experiencing the furlough system. And obviously furlough was administered in a different way. It was administered outside the traditional welfare system, but it's still an experience of being supported by the government while not in work. So you might expect that that might lead people to feel a little bit more solidarity with people who have been unemployed. The second reason to expect change is that these groups were written about and talked about in a very different way than claimants have been in the past. So the media coverage of claimants was much more sympathetic. There was very little of the usual kind of victim blaming or benefit sheet chasing that you see prior to the pandemic. And also when you looked at the way that government ministers talked about the benefit system, rather than using this language of it being a burden that we need to reduce, there was actually a lot more talk about it being something that we could be proud of as a thing that Britain has that supported people through the pandemic. And the third reason really to expect this kind of quite profound shift in attitudes is that COVID, especially early on, was, and again, at least on the surface, a time of national solidarity. You saw these very visible expressions of solidarity and lots of messages about us all being in this together. You've got the claps for the NHS and essential workers. And we've had some people in the media describing this as potentially a new beverage moment. So you put this all together and it suggests that, you know, we might see this quite big change in people's attitudes towards the benefit system. So let's have a look at what actually happened. And the short answer is that this profound change didn't really materialize. So this is data from YouGov's welfare tracker series, which they kindly shared with us. And it's this quite uniquely detailed time series of data, because this is data from national surveys that are conducted every 8 weeks throughout the pandemic and prior to the pandemic beginning. And this graph here focuses on two measures from these welfare trackers. And both lines here represent what we might think of as anti-welfare feeling. So if the line goes down, that means people are becoming more sympathetic towards benefit claimants. Whereas if the line goes up, it means that people are becoming less sympathetic. So if you look at the green line, this is people's answers to the question of essentially what percentage of people who are claiming unemployment benefits do you think are genuinely in need and deserving of help? So here this line represents people who think that half or fewer of claimants are deserving. So this kind of anti-welfare position. The blue line is attitudes towards benefit levels. So this is the percentage of people who are saying essentially that they think that benefit levels are too high. So if you look at the first wave of the pandemic here, so this is the first lockdown. So this gray bar here represents the first lockdown. And this is, people's lives have changed, you know, in a very fundamental way. This is the biggest change to people's lives that most people have experienced in their entire lives. These expressions of solidarity that I talked about are at their peak here. And you can really see that the lines have just really not moved very much at all. You see this very slight dip, so this very slight increase in sympathy, but that basically recovers straight away when you go into the summer of 2020. So when the first lockdown ends and we move into the summer where things got a little bit better, these attitudes go basically straight back to where they were before. Oh, even in the case of the deservingness measure, actually get less sympathetic than they were before the pandemic started. Then you see into the second wave, you get this slight increase in sympathy again, slightly bigger increase in sympathy for the deservingness measure. But again, that's because probably it became much more negative during the summer. And so it's got further further to fall. So if we're just looking at 2 of these welfare trackers here, but if you look at the others, you see a pretty similar pattern. You have pretty small changes in attitudes that aren't really sustained once you come out of the lockdown period. And you can also compare these changes, these kind of small changes that we're seeing during the pandemic, with the gradual softening of attitudes that's been happening over the last decade. So this is just looking at the "are benefits too high" measure. And you can see that if we go back to April of 2013, you've got about 35, 36% of the population thinking that benefit levels are too high. Whereas we go to just before the pandemic started, and it's actually closer to 17% or so. But you can also see that the pandemic has not had anyway. You've set the changes that you see during the pandemic. These small changes, they're nothing compared to this general change that's happened over the last decade. So the question then becomes, if we had all of these good reasons to expect that the pandemic would have this kind of dramatic effect on welfare attitudes, why didn't this actually happen? Why aren't we seeing that in these welfare trackers? And the main answer that we've sort of proposed is what we call COVID exceptionalism. And I think, Kate, you might be the one to coin this term. And essentially the argument here is that people saw COVID claimants as a fundamentally different sort of person from conventional claimants. So they are mentally categorized as a separate group of people. So attitudes towards COVID claimants, towards people who've become unemployed during the pandemic, can be quite positive. So this group could be seen as very unlikely to be actually to blame for being unemployed or otherwise being in need, and is much more likely to be sort of normal people like us who've hit upon hard times because of this exceptional thing that's happened. And that leaves, or can leave, attitudes towards kind of normal or non-COVID claimants, pre-COVID or post-COVID claimants, relatively untouched. So these attitudes towards COVID claimants are quite a bit more generous, but the attitudes towards regular claimants haven't really changed. And if these general questions, these questions that we're asking people about, are benefit levels too high, what proportion of benefit claimants are deserving, if they're largely driven by people's attitudes towards this kind of conventional group of claimants rather than by their attitudes towards COVID claimants, then that might be an explanation for why we're not seeing this profound shift in attitudes. So we've got some evidence for this idea that comes from a novel YouGov survey that we conducted. So this is not the welfare trackers. This is a new survey that we at the Welfare Social Distance Project conducted in June of this year, which delved into people's attitudes in a bit more depth. And what we found was that first, COVID claimants were seen as significantly less blameworthy than pre-COVID claimants. So they were seen as significantly less to blame for losing a job. You can see here that only about 5% of people thought that any reasonable chunk of COVID claimants were actually to blame for losing their job during the pandemic, which actually I think kind of contrasts a little bit with what Bobby was saying. So that might be something we might want to come back to in the discussion. And also, when we asked people whether COVID claimants were more or less deserving of support, the balance of responses was very strongly tipped towards COVID claimants being much more deserving. And we also found, when we looked at this idea of these general attitudes being driven by people's perceptions of COVID claimants, or are they being driven by people's perceptions of pre-COVID claimants, we actually found it was the latter. So when you ask people these general questions about what do you think about the benefit system or benefit claimants, their responses to those questions seem to be being driven much more strongly by their pre-existing stereotypes and perceptions of claimants, and not by their feelings about these exceptional group of claimants during COVID. So the last thing I want to very quickly say from our data is that we didn't just ask quantitative questions, we also asked people an open question in our survey about what they thought were the main differences between COVID and pre-COVID claimants, if any. And we applied this machine learning technique called structural topic modeling to sort these responses into different categories. And a couple of what I'm showing on the slide here is a couple of the examples of the most popular categories. I'm not going to read them out here in the interest of time, but essentially what these responses really demonstrated was that, again, people are drawing this distinction between COVID claimants, who they consider to be these kind of normal people who have established careers, who want to work but are being prevented from doing so by the pandemic, and contrasting those with pre-COVID claimants, who are these people who they have more stereotypes about that group of people being people who don't really want to work or are different from you and me. So the implications of this seem pretty dismal, at least if what you want is a more generous benefit system. You know, this massive event didn't move the needle in the way that we might have expected. And one way of thinking about that is that this kind of general increase in sympathy that we've seen over the last decade means that we've reached a sort of ceiling for people's sympathy for claimants. You know, attitudes have been getting steadily more generous, so maybe there's just more room for them to get more generous. But I don't actually think that's what these results show, because the positive attitudes towards COVID claimants, these kind of even more positive attitudes towards COVID claimants, suggests that there is actually some scope for more solidaristic attitudes towards claimants, depending on how they are perceived, and also for a potential scope for a more generous welfare system. You know, support for the UC uplift, which came to an end yesterday, was actually very strong in our respondents, and so people generally supported that and supported maintaining it on a permanent basis. So if these things are framed as COVID related, people actually have stronger support, which does seem to suggest that depending on how we frame increases to generosity and benefits, there is actually scope for more generous attitudes. So that's it from me, and I'm going to hand quickly over to Kate.
Thanks, Rob. Just getting... Okay, perfect. So what I want to spend the couple of minutes that I've got doing is coming from a sort of another direction from the Welfare and Social Distance Project to add something different to the discussion. I'm going to think about briefly the contributions of in-depth interviews to studying attitudes to social security benefits. In the interest of time, what I'm going to do is summarise what I think some of these contributions are first, and then show you one example, and then maybe we can pick some of these things up in the Q&A at the end. So one of our welfare and social distance work packages involves in-depth interviews with social security claimants themselves. We interviewed 74 people last summer and then re-interviewed 61 of those people this summer. We include in our sample people whose claim had started before the pandemic, but then also people whose claim started during the pandemic. And we asked people explicitly, amongst other things, about their attitudes towards claiming. So thinking about the methodological contributions that these interviews have the potential for making for our understanding of attitudes, I wanted to highlight 4 key points. The first and perhaps most obvious thing to point out is the potential for nuance afforded by this sort of in-depth method. And we can see attitudes being expressed in the context of a larger conversation here, obviously, which gives the participant the opportunity to unpack their views. Secondly, we can get at aspects of change, but in multiple senses. So this includes change over time between interviews, but also changes in attitudes following certain events or experiences as narrated by participants. And then also change across the interview itself as the participant reacts to the questions of the interviewee. Thirdly, and what I want to unpack a tiny bit more, it's interesting, I think, that we can observe how potentially contradictory attitudes are held and expressed. So obviously attitude formation and expression can be messy and it can be dissonant, and we can get more directly at how this is kind of navigated and resolved or not resolved in an interview setting. And lastly, I think it's important to note that we can think of the interview itself as a sort of intervention. So this can be thought of as sort of for better or for worse, in that it's not a particularly sort of naturalistic thing to sit down and talk with a stranger for an hour about how you feel about things, but it does create an opportunity that prompts people to reflect and negotiate their attitudes out loud and explicitly. So what I want to finish mine and Rob's presentation by doing is to briefly illustrate some of these contributions with a phenomena that we're currently exploring in our data, where what we find is expressions of social security benefits among claimants themselves, both being thought of as financially inadequate, but also at the same time as fair. So on the face of it, that would seem quite difficult to hold those two views at the same time. But then what we see is how participants sort of work to resolve those two things, those two views. So you can see here we've got an example of Douglas, who's a new, which means during the pandemic he started a claim for universal credit. And you can see here in what I've highlighted him saying that the amount he gets in universal credit is not enough, but he does think it's fair. And he puts this down, you'll see in the highlighted bit, as him saying he has higher needs than most people. But then what transpires as the interview progresses is that what he thinks of as higher needs is that he has what he describes as high rent costs that he pays so that he can live close to his non-resident children. I've not included the extract that shows all that because it's quite long. And then he also goes on, and you'll see in the next highlighted bit, to talk about how he's incredibly careful with his money, and that his one self-described extravagance is an £8 a month Disney Plus subscription for his children. So as Douglas says, it's better than nothing is how he describes his universal credit claim. And I think, and I realise I'm talking through this very quickly, but again, it's something maybe we can pick up in the Q&A. What we see then for some of our participants is this reconciliation being negotiated when they talk, whereby personal adequacy of payment levels is not directly given as a criterion for fairness. Fairness in relation to adequacy is instead benchmarked as something being better than nothing. And you see this, Douglas saying this very directly. And I think then, sort of just to flag, there are multiple ways that this links to our thinking about adequacy within the social security system, which is something that we've explored within welfare at social distance, and then also satisfaction, how claimants report and talk about satisfaction within the social security system. I'll flag those and leave them as maybe something we pick up in the discussion. Thank you very much.
Thanks, Kate. Thanks, Rob. I'm going to hand straight over to Tanya, if I can. I'm conscious of time. Tanya, over to you for the final presentation, reflecting on some of the long-run changes in attitudes before COVID.
I'll just unmute myself, that would help. I'm going to take a step back to consider what the context for policymaking was like on the eve of the pandemic. This is joint work with Keris Cooper, who's now at the Education Policy Institute, but she's here in the audience today, I'm glad to say, and ready to engage in the discussion. My talk's going to fall into two quick parts. In the first part, I'm going to show some results on long-run trends in attitudes towards welfare and inequality that form part of the Social Policies and Distributional Outcomes programme led by Polly Vizard and funded by the Nuffield Foundation. The part of the programme I'm going to talk about focused on describing the attitudinal context for policymaking and assessing in particular whether there was evidence of polarisation in attitudes in the run-up to the pandemic. In part two, I'm going to take a further step back to question what we mean by attitudes towards welfare in the first place and why we care about them. Crucially, in my view, and sort of discussion that Kate's already begun in what she said, what are the different ways in which we can go about finding out about attitudes and what implications they have. And I'll finish very briefly with some reflections on what this implies for both the future research and policy agenda, which draws both on the methodological discussion and on the conclusions of SPDO. So first of all, on the attitudinal context for policymaking. Keris and I used the British Social Attitude Survey, which many of you will be familiar with. It's a nationally representative household survey, great for long-run analysis of attitudes, but with a relatively small sample that limits the breakdowns that one can do in some respects, particularly in relation to ethnicity and to small area geography. We focus on two attitudinal indices. Putting together several questions in an index is often a more robust way to measure attitudes, particularly over time, than looking at individual questions. The first of these indices is the welfareism index, which has been used by the British Social Attitudes in their publications. It's based on those questions that you see on the slide. And although it's called the welfareism index, in fact, 6 out of the 8 items relate to social security in particular. So this is mostly welfare in the meaning of benefits rather than broader welfare state. Some of the items are reverse coded so that you can aggregate it into a consistent score. And the way that the BSA aggregate it means that a higher score indicates a stronger anti-welfare attitude, which is sometimes a little bit confusing. The other index is one that we constructed ourselves based on these 3 questions about inequality. And again, higher scores indicate less concern about inequality. So in a sense, it's scored the same way as the welfarism index. So those are the 2 indices that we use. We look at trends over time, and we look at trends for subgroups, in particular, trying to see whether there's any evidence that people diverged in their views over time when we control for other characteristics that might be associated with those principal subgroups. So very quickly, taking the more than 2-decade look from 1995 through to the eve of the pandemic, and this first chart showing attitudes towards welfare. In the late 1990s, we can see that people became more anti-welfare. That stabilized in the 2000s, and then they became more sympathetic towards welfare again from 2010 onwards. And this is consistent with what Pearce and Taylor suggest, is that a broadly counter-cyclical attitude change, that when spending on welfare goes up, attitudes towards taxation become more hostile, and when spending goes down, attitudes become more generous. I think one can overstate that, but broadly speaking, that's the story. And we see a similar pattern in relation towards inequality, reducing concern about inequality in the first part of the period, turning towards greater concern from 2010 onwards. So I think the key point here is that the pandemic arrived, as we know, after a decade of austerity, and at a point when attitudes towards welfare were already becoming less hostile and concerns about inequality were already increasing. Had attitudes become more polarized despite that over the period? Well, in the full paper that you can see a whole set of results where we go through both for welfarism and for inequality, looking at the characteristics of disabled and non-disabled, lone parent versus couple parent versus not parent, excuse me, older and younger people, higher skilled, lower skilled, people in different parts of the country. And we find no evidence of increased polarization for either welfarism or inequality. We either see convergence or, as in this example, stable differences. So disabled people are more sympathetic towards welfare than non-disabled people, but that's broadly remained the case throughout this period, with a little bit of divergence in the middle and convergence at the end. So I'm going to skip through the other charts here in the interest of time, but by all means look at the slides afterwards or ask me about them, or look at our paper. So overall, and I appreciate this has been whistle stop, the attitudinal context for policy making, I think if we compare the pre-pandemic period to the period immediately before the last major crisis in 2008, we see that attitudes were more positive towards welfare going into the pandemic, and there was greater concern for inequality than just before the previous crisis. We also see that some of the groups that are more directly affected by welfare are, in a consistent way, more supportive of welfare and often more concerned about inequality. But we've found no evidence of widening gaps in attitudes between them and the other more advantaged groups, despite the divergence in their actual objective circumstances and experiences. So all in all, as others have said, I think there is a suggestion that there was a window of opportunity for more progressive policy making to capitalise on that attitudinal space, and certainly that there was no reason to be deterred by perhaps exaggerated accounts of division and polarisation, at least along the lines of the characteristics that we looked at. But what do we really mean by these public attitudes, and why do we think they matter? Now, I'm aware here that Bobby has spent a large part of his life thinking about these questions, and that Kate both teaches on methodology and has indeed developed new methodologies in this area. So this is really by way of an invitation to open out that aspect of our discussion today. Why then do we care about attitudes? What do we mean when we're talking about attitudes, and why should we care about what attitudes are towards welfare and inequality? Well, one possibility is that we want to understand how attitudes will determine what happens, what policies will actually get adopted. That might suggest a focus on the attitudes of the people whose views will be decisive, generally, of course, people with power and influence. Alternatively, we might be interested in predicting how people will vote, although for that, of course, we also need to know whether welfare or inequality are salient issues for them, not just what they think, but how much it matters to them. Or we might want to evaluate how people have reacted to changes in the world, like the COVID pandemic, or to policies like the universal credit uplift or its removal. And some of what we've heard today, I think, has focused on that kind of approach. Or conversely, we might want to understand how people's attitudes is affecting what policies are being implemented or could be adopted. That's the kind of approach I was taking in part one of the talk today. It's worth noting that those two approaches suggest contrary causal pathways. In the first place, the belief that policies shape attitudes, and in the second, that attitudes shape policies. And I think it's crucial that we keep both of those in view. In a deeper sense, we might believe that government by consent requires policies to be broadly in line with what the public really wants. And we need to find out more often than we can and in more detail than we can than is revealed by an election. And so that might point to being interested in public debate and informed public debate and attitudes as expressed in that way. Finally, if we think that policies are being done to a section of the population, we might feel that it behoves us to seek their views and understand their attitudes, and indeed empower them to participate in the decision making. So I think you can see here a kind of spectrum from the least to the most radical approaches to understanding attitudes, and from the least to the most involved approaches. It's clear that all methods have their place, but it seems to me important that we are reflective about whose thoughts we're trying to capture, whose attitudes, what kinds of attitudes, whether it's their immediate off-the-cuff reactions or whether it's the kind of conflicted points of view that Kate was talking about, or indeed whether it's something more deliberative where they're encountering other people's points of view, engaging in processes of public reasoning and having the opportunity to acquire new evidence and interrogate it in coming to their points of view. Zooming in on the two methods that the papers presented today have used, we can see the contrast, first of all, between whose attitudes we're talking about. Is it the general public or is it specifically claimants? And the different assumptions about what kind of thing an attitude is. Is it something that's individual and pre-formed, or is it something that's constructed through dialogue and contingent on the setting in which it's being measured? In my view, attitudinal surveys are very valuable for consistency and for measuring change over time, but they will tend to give us an artificial and somewhat shallow picture of people's attitudes, whereas interviews are helpful for revealing those conflicts and uncertainties and the fact that people don't have fixed views necessarily. But if our reason for being interested in attitudes is something closer to the concepts of democracy and participation, then I think we need to move to group deliberative methods, either with the general public, such as in the Deliberating Inequality project that's been led by Kate with others, or indeed the Fabian Society Citizens Jury that they undertook earlier this year on reimagining social security, or with experts by experience, such as the Commission on Social Security, led by people with lived experience of benefits, an initiative that I know Kate was also involved with. And if we set alongside those deliberative methods against surveys and in-depth interviews, we get a different kind of picture, where attitudes are formed and reworked through assessing evidence and engaging in a process of public reasoning. Justifying your position in a way that makes sense to others is a much higher test than simply ticking a box on a survey form. This process can be valuable, of course, in and of itself as well, as a counter to political apathy or cynicism in the case of a sort of citizens jury approach, or where people with direct experience are involved as a way of affording them recognition and enabling to assert their dignity and their citizenship rights. So to sum up, I think the choice of method depends on the aim of the exercise, whether it's predicting behaviour or whether it's about participation and empowerment. It depends on what kinds of things we think attitudes are. Are they preformed and individual, or are they contingent and social? And on how we could think we can come to understand what those attitudes are. Are they accessible through a survey instrument that can be robust and quantified, or are they only articulated through deliberation? And crucially, I think it depends on our values, our normative position, whether we adopt the position put forward, for example, by the disabled people's movements in the 1970s, that there should be nothing about us without us, which applies equally to poverty as it does to disability, in my view. So what does this imply for a future research and policy agenda, drawing it together? Well, one of the 5 key challenges that the SPDO programme identified for the future of social policy was to embed a values-based approach into social policy, making explicit in the first place the values of dignity, of recognition, and of social value, not just market value, and embedding them in the fabric of public service design, delivery and monitoring. And I think we could add that might also apply to the research that informs those public services. This isn't entirely pie in the sky. There is existing good practice to build on. I would point, for example, to the way in which human dignity has been enshrined in legislation as a guiding principle of Scottish social security, and that this is now being scrutinised by an independent commission with participation of experts by experience.